Well, thank you for having me. I'm just really honored to be able to participate in this amazing event. As I was talking to Bob McNallis earlier, it's very intimidating to be in a room with this many practice facilitators all in one place, because I myself don't consider myself to be a practice facilitator. You guys do all the work, and I just try to understand and study what you guys do and how and why you're so amazing as a group of people who are virtually change agents out there in primary care and in improving the lives of people who work in the primary care setting, or more importantly, their patients as well. So. This photo is actually the group of practice facilitators for the Healthy Hearts Northwest project the ARC-funded project that we're currently doing. And this was one of our training sessions that we held. I don't even remember. Golly, it was a long time ago. With our practice facilitators. I don't remember if it was the first one or the second one that this photo was taken in. But as I'm sitting here thinking about building a practice facilitator learning community, I'm standing here saying, but that's what this room is. You guys are building a learning community yesterday and today. Just by your presence here, I've seen a lot of people exchanging emails and phone numbers and business cards and, oh, tell me where I can find that. Do you guys have that up on your website? Can I get that tool? Oh, you have a dashboard. Can you tell me about that dashboard you've developed? So we are in the middle of creating a learning community yesterday and today. And that's what we're actively doing here. So I feel a little stupid talking about how to develop a learning community, but we'll give it a go. Let me just, that's what we said we would try to accomplish today. And really, I'm just here to try to set this up for a discussion. So the town hall, just to follow this, I just want to be a little provocative. So a little background again, you guys are tired of hearing about the history behind all this. Is the idea of the extension agent as a role for practice improvement, practice transformation. Some of the ideas early on came out of looking at the agricultural cooperative extension agent model here in the United States. And it's referenced in a lot of the early work and writing done about, at least here in the United States, about practice facilitation. But if you go back, we stole all of our ideas from Canada and the UK before that about the idea of a practice facilitator as well, in primary care at least. So this is an idea that's been around for a long time. Nothing new. And actually, if you think about the Cooperative Extension Agent Program and why it was created, it was actually a legislative act by the U.S. Congress. It was passed in 1914. And it was a partnership between land-grant colleges in the U.S. And the U.S. Department of Agriculture, because they recognized a need for the agricultural community, and back then there were mostly small farmers, think of small practices, to help them figure out how they could do their work of farming more efficiently, more effectively, and produce enough food to feed the U.S. population, because there was some concern back then about food poverty and access to food and nutrition in the U.S. So it was an interesting partnership between the university setting where they were doing agricultural research and the agricultural Department of Agriculture that was charged with supporting the farming community. So there was an interesting two-way street between the two, in which the agricultural extension agent worker would actually go out and talk to the farmers and the farming community and then come back to the university and say, you know, here are the questions they have. Is there any research that would show the comparative effectiveness of different ways of planting this type of crop on a field that is slanted at a 10-degree angle facing southwest? And back in the university, the researchers would scratch their heads and go, no, we don't know the answer to that question. And the field agent would say, well, then get me an answer, because I need to know. I need to go back out and help this farming community with that issue. And so they get busy and they'd figure out how to answer that question, and then they'd give the answer back to the extension agent, who would then go back out and deliver the results of the research to the farming community, right? So there was early work actually on this concept of the diffusion of innovation. How many of you have heard of diffusion of innovation theory? Came directly out of studying how the agricultural cooperative extension agent system worked. It was a study done in Iowa many, many years ago that developed diffusion of innovation theory based on what they learned about how the extension program worked. But these extension agents were based out of a university, and they had a natural learning community. Not only did they learn from each other, because they were all based out of the same land-grant college at the time, right? So they knew each other, and they were their home base. They had a home base. They came back to the land-grant college. That was their home base back then. But they also were able to challenge the home base to deliver answers to important questions that they had. So it's a struggle for how you create a learning community to do that. Well, skip ahead to 2010, 2011. It was recognized that this model or this approach could actually be valuable here in the United States. And I'm sorry, I'm giving a little bit of a U.S. perspective for those of you who are here from other countries. But the Patient Protection and Affordable Care Act of 2010-2011 actually has Section 5405, which is the primary care extension program, to create a primary care extension program. Great idea. But the funding was never authorized. So there was never any funding to support this section of the Affordable Care Act. So it's something that is still there. It's still a part of our standing legislation. And if someone ever decided that they wanted to fund it, they could, because it's a section in an existing bill that was passed by the U.S. Congress. So there's always hope. One of the readings that I continually go back to, and if you haven't read this article, it's a required reading. And I've read this article, I can't tell you how many times, and every time I read it, I get something new out of it. It's Whitney Berta's and her colleagues' article called "Why We Think Facilitation Works." It's just a great exposition on what is it about facilitation that makes it so effective, from sort of both a theory perspective, but also kind of a practical perspective. And they define facilitation as assisting in defining practice problems and objectives, highlighting important contextual factors, and assisting teams in interpreting data and reaching conclusion about action-outcome relationships. You know, in a nutshell, it's about this experience I had back in the summer of 2008 when I went with one of our facilitators to visit a small practice on the north side of San Antonio, Texas. It was really hot outside. It was like 104, I think, that afternoon, and I was really happy when I learned that the facilitator who was taking me out to visit this solo physician practice knew the key code combination on the back door of the office, so we could get in out of the heat really quickly. But that was one sign to me that this facilitator and this practice were engaged with each other, because she knew the combination to the back door to get into practice. So we were sitting around with the over lunch with the solo physician and the medical assistants and the RN and the front desk staff, and we were talking about controlling blood pressure in people with diabetes, which was the nature of the funded grant we had at the time, and they were enrolled in this project. And I remember us just sitting there and we were talking about measuring blood pressure and the workflow of measuring blood pressure, and the physician sort of leaned back and said, well, you know, I just don't trust the blood pressure measurement that's in the chart. And the nurse kind of jerked, what do you mean you don't trust the blood pressure measurement in the chart? And the physician said, well, I watch what you guys do with these patients. You rouse them out of the reception area, you make them run down this long hall and you get them up on the scales and weigh them, and their blood pressure shoots up because they're worried about how much their weight is. And then you rush them into the exam room and take their blood pressure with their legs crossed, and they're sitting on the end of the exam table, and you know. And it dawned on me that the reason this conversation was happening was because I and the facilitator were present in the room. And it was never a conversation that was going to happen without us there. And I remember Lindy Knox telling me once, this is the example of the foreign exchange student coming to your house for Thanksgiving dinner, right? The foreigner at the Thanksgiving dinner table totally changes the nature of the conversation at the family Thanksgiving dinner. The tone of the conversation is just a little more respectful. People actually inquire about how things are going with each other. It just changes the tenor of the conversation. And I was like, oh, this is why facilitation works. It enables them to have these sense-making conversations about what's going on in the clinic and the practice. How do we make it better? So how do we create learning communities to do that? And how do you develop the core knowledge and skills to be able to do that in terms of this facilitation work? And that's what you guys are exploring yesterday and today. So what are core knowledge and skills that are required to do this work? Well, increasingly we kind of have some ideas about what those might be. In some of the practice facilitator curriculums that have been developed. But the question is, how and where do you acquire these knowledge and skills? And how do you update them? I mean, is it just one of those one-time approaches to acquiring knowledge and skills and then you're good for life? Well, the things I've heard yesterday and today suggest the answer to that is no. You're always learning new things as a facilitator about how you can do your work better. You're being asked to do new projects that are new content areas that may require a different set of skills or knowledge content that you've had before. One of the issues that you guys struggle with, of course, is going into a practice and being perceived as a credible source of information, right, for these practices. So how do you acquire the knowledge and information you need to maintain that relationship in which you are a credible source of information for practices? So this is just one example. This is the AHRQ curriculum. It's one small piece of it. This is part 2 of the curriculum. But it just gives you some sense of the kinds of things and knowledge and skills that facilitators are expected to have, right? And it's one thing to read these modules and to read this material and discuss it. It's an entirely different thing, as you guys know, to get in your car and drive 30 minutes to 2 hours to a practice and walk in the door and try to take this knowledge and apply it to that context in that setting. So how do you do that? And how do you develop a role identity and ability to do that? Well, the idea here is that one way to do that is to establish a professional learning community. It's a group that meets on a regular basis. It shares expertise. You work collaboratively with each other. You develop mentorship opportunities. because you're wanting to continually improve your skills and your competencies in this area. The professional learning community concept actually came out of the educational field, the field of education, of getting students together and learners together in an informal learning community or a formal learning community where they had to work together and learn together. Because we all know learning is actually a social process. Knowledge acquisition is one thing, but learning means you know how to apply knowledge into action. And that usually requires that you do it in a social setting, and it requires a dialogue or a conversation for that kind of learning to happen. But as practice facilitators, I would challenge you guys to think about how you're going to do that as a group, and think about that. So common ingredients to learning communities, just to think about. A typical learning community has a common purpose and a shared goal that is explicit. It's not implicit, it's explicit, it's written. People know about it. People know the purpose of this learning community is blah, 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 blah. So I would challenge each of you as you're sitting at your table and eating your lemon tart dessert to think about what would you write as the purpose of a PF learning community? What would that purpose statement look like? And what would the goals be of having a learning community? Secondly, a learning community requires that you identify the needs of the learners. So if you're going to establish a learning community, you need to think about the method you're going to use to continually, ongoing, iteratively assess needs of the learning community. You can't just, it's not a it could be a one-shot deal. You can say, oh yeah, we're going to do a 6-month learning community and that'll be it and it's over. But most learning communities tend to reinvent themselves and to iteratively assess needs and develop new plans for addressing the needs of the learners. You've got to have a way to make the learning community collaborative. It needs to be a safe place where there's trust, right? And as someone said at a table this morning I was sitting at, you need a place where you can go and feel comfortable asking stupid questions. And, feel like, maybe I'm the only one who doesn't know this, but can I ask a question? It needs to be a place of trust and respect. So how do you build trust and respect into a learning community when there are already a diverse set of skills and experience in the people who are joining the learning community? So how do novices, beginners, feel comfortable asking those questions when they know there are people in that learning community who've been doing this work for 10 years, right? It's a little intimidating as a learner to be in that kind of a learning community. And respectful interactions. Be able to say, that's not a stupid question. That's a great question. I've really struggled with that question. And you've got to have adequate time, and that's always a problem, is figuring out how you're going to create time for those interactions to happen. And many learning communities bring in experts as needed. So they'll invite someone to a session for a conversation, someone that they feel like has specialized knowledge or skills for a specific topic area that they want to address as a group, as a learning community. So they bring in some experts to help them with that. I think you need to ask yourself why. Why are we interested in creating a practice facilitation learning community? What needs exist that are currently not met? Some of you have organizations that are large enough and you have enough facilitators, critical mass of facilitators, that you already have a virtual learning community of facilitators. I mean, you've created some mechanisms for them to get together. We have a Monday morning huddle phone call with our facilitators for Healthy Hearts Northwest that Nicole Van Borkula, who's here in the audience, leads that call. She knows far more about creating learning communities of facilitators than I will. And I'll introduce you to her in just a minute. But then how will that learning community address those needs, right? It's not a one-size-fits-all. what is the forum that you'll use to address those needs? In some cases, a simple email may answer a question and address a need. In other situations, an email or a text message or sharing a document is not enough. It requires a conversation. So how and when will those conversations or dialogues take place? And how will you create space for them to happen? And then what will success look like? How will you know a learning community is successful? I think it's really important that you come out the gate and say, here's how we know we've created a successful learning community. These are the indicators. These are the markers we're going to look for. And if we don't see these, we're going to go back to the drawing board and say, this isn't working. Let's redesign this. Let's figure out a different way to do this. So PDSA, the learning community. And then, is it over? I mean, at what point does the energy level for the learning community drop so low that you say, we think it's time to call it quits? That's okay. You don't need to, keep a learning community in the ICU on a ventilator for many, many years. It's just ridiculous. It's a waste of everybody's time and resources. So think those things through. I've mentioned this already, which is think about the purpose of it. Some learning communities, what you want them for is fast learning. I need a workflow. I need a PDSA worksheet. I can't get the practice to return my calls. What should I do? But then there's those larger questions in a learning community that as facilitators, you're trying to figure out, how do I tailor support for a clinic that has high turnover? Or how do I figure out what readiness looks like in this clinic and when they are ready for the next step in this project? Those kind of questions, which are not simple answers. It requires a longer conversation. So you need to think about creating a learning community that can do maybe both, right? So how do you create a learning community that is set up for both fast learning and this more reflective, deeper learning? So I mentioned to you that there's some principles or ideas. Again, I would be explicit about the purpose. I would conduct iterative, ongoing needs assessments. I'd recommend that you figure out tailoring the learning to different levels of learners, the novice and the expert, the more experienced. Create the infrastructure for both fast and slow learning. And finally, don't underestimate the cost of the infrastructure it would take to build and sustain a learning community. And where is that going to come from? I mean, are you guys just going to take it out of your own hide? I already heard you're working 60 and 70-hour work weeks, most of you, right? So where is that going to come from? Who's going to support the infrastructure of this learning community, this communication piece? And then don't forget about the powers of telling stories in the learning community and bringing stories to the table. I think that's a really important piece of a learning community. So I want to introduce Nicole to you. Nicole Van Borculo is, as I mentioned, is leading the practice facilitation component of our Healthy Arts Northwest. We actually have two groups that are doing practice facilitation. Qualis Health, which is the QIO for Washington and Idaho, and the Oregon Rural Practice-Based Research Network in Oregon. And Nicole somehow tries to bring those two people together around facilitation and doing the same thing, which is kind of interesting to watch because they're two different organizations and have come from two different places. But Nicole and I were talking about creating learning communities and thinking about what type of learning community can you create. And I've asked her to come up here and share some of her thoughts about the idea that there may be a national level learning community that is different than a local or regional level learning community. So Nicole?
I actually found that, hello everyone, I found that the structure that Michael talked about, it didn't fit so neatly the national level for me, thinking about what would be the purpose. Was really to support the profession of practice facilitation. That's what I've been hearing today and yesterday about, you know, what do facilitators do? What are the requirements? How would certification work? We have some programs I just heard about that do a certification process, but you know, are they the same across the board? We have 5 or 6 now that I've heard about in the country, and are they doing the same kinds of training? And so, so just sort of generating some ideas. I don't know that these are the right answers, but in my mind, at the national level, and in the conversation with Michael, and actually talked to a couple other folks in the room this morning about it, that might be the place where things about accrediting training programs and what would certification requirements be for PFs, and would there be ongoing continuing education required. It might be the place to find the information on PF training programs and opportunities. I think in the last 3 or 4 years, maybe 5 years, I've been asked at least 3 or 4 times a year by younger people who are interested in this work, doing this kind of work, where do I get trained? And not feeling competent to answer, this is the best program or this is the best program, because not feeling really clear about what each of them provides. And so I think having a place where there's information about that would be helpful. Advocating for the role of PFs in healthcare could be something that might be done at that level. Supporting organizations who want to start up a PF program within their organization and how they might do that. Convening organizations or entities who have or want to build a PF program for shared learning. So almost that would be where I could see the learning community happening with organizations that are doing this within their organizations, within their clinic system, having a place to go and talk to other organizations who are doing that. And then maybe potentially providing training or participating with organizations that are providing training for PFs. So in my mind, that feels like what the national level, the fact, one of the things I've noticed in evidence now, as one of 7 cooperatives, we have practice facilitators, all the other cooperatives have practice facilitators, and asking the facilitators to participate at national level PF calls, I mean, they do it. Many of them do that, and I'm impressed, but it's one more thing on top of that 60 to 70 hour week, right? And so the opportunity for PFs to participate in the learning community strikes me as more of something that should be done at the local or regional level, where they can talk about their work with people who are doing the same kind of thing on the ground, where they're going to get the most bang for that time that they're spending. And so the kinds of things, the purpose at the local or regional level, I think would be really to support the PFs in their role, or the organizations and programs that are using PFs. And the opportunities here are the things that Michael talked about. Cross-pollination about what's happening in clinics and sharing ideas, cross-pollination between facilitators about the kinds of work they're doing, how other organizations are structuring their programs. I mean, there's so much learning that happens in a conversation that doesn't, you know, that we feel so isolated out in the field when we're doing our work, right? Sharing of tools and resources, problem solving specific issues. You know, I love when I'm on a call with some of our facilitators and somebody says, okay, I have this clinic and this is happening. Does anybody have any ideas? And there are always great ideas to be shared, and that's what's so lovely about it. Everybody's had a hard clinic. Everybody's had the provider who's not very kind to them when they come in the door, things like that. Mentoring, developing new skills, all of these things I think could happen at the local and regional level. And I think a big one right now that, and again, I added this last minute this morning, was because I've heard a lot about it, is helping to align initiatives in your region. So not every clinic that you go into is participating in the same projects. And so you may go into one that's doing something that you hadn't heard about or haven't really been exposed to. And the opportunity to align, for alignment would be really useful. So those were just sort of off the top of my head with some input of the ways we might think about these at those different levels.
Great, thanks Nicole. Really great, and I just couldn't help but put this up here. I found this as I was thinking about the role of the practice facilitator in care. And we need. I think at the next national meeting like this, we need to have some T-shirts like this available for everybody who comes to the meeting that says practice facilitator, because freaking miracle worker isn't an official job title. Okay, that's what I have. I just wanted to start this conversation. I think we're a few minutes ahead of time, but do we have time for a couple of questions, if anybody has questions, before we jump into the town hall? Would that be okay? I'm going to proceed until apprehended. I'm going to assume that it's okay. So, anybody have any questions, comments? Anything that I said that was provocative, stimulating, somnolent? Yeah.
So for the town hall, should we be sort of aspirational? Should we be, big picture, really what we could have, if it's possible? And then say feasibility for another day, or how would you suggest we?
I always approach things by dreaming big and then scaling them back. That's just the way I work. That's my model, which is to dream what's possible and then sit down and be realistic about it and say, okay, well, yeah, that would be ideal, but what could we put together now that would be effective? So that would be my approach, but I'm not the one who organized the town hall meeting. So I'd be interested in those who are thinking about the town hall session. What did you guys have in mind? Sure.
So I think you feel bad when having an accreditation program for practice facilitators, but at the same token, and I don't mean to offend probably the majority of people in the room, but when you look at the accreditation programs that have been done for like the PMP certification, they often don't have a lot of relevance to project management in the real world. So you can have program directors that have a hard time passing the PMP because it doesn't make sense to them in the context in which they do the work.
And PMP is?
It's a project management professional certification program.
Right.
So it's a nice, if you will, flair to have, but it's not terribly meaningful, I don't think, outside a very specific discipline of project management, which tends to be very IT focused and go very siloed and measured and all of that. And so I wonder, seeing both sides, how you would do an accreditation program that had validity and flexibility in a clinic and wasn't just a way to require people to jump through another hoop that actually had value.
Yeah. The whole PF certification idea has been controversial. And is still widely debated about whether there should even be a certification process. There are pros and there are cons. You could argue it both ways. And I don't know that I have the answer for that.
I wondered how it was debated or how you would think about structuring it so you've got away from maybe, for lack of a better way to say, like a nationalistic kind of money-making stamp of approval versus something that was applicable, more applicable.
I don't know. That's a great question because the role of the PF and the skills and the competencies you need to do your work shift a lot. I think some of the things we have learned is that at least the way primary care currently works, the way primary care currently operates, the most primary care clinics, there probably are, at least right now, sort of some core essential things you ought to know as a facilitator that should be like, everybody should know this, right? If you're going to do this work. But beyond that, in terms of what you should know and whether or not there should be, oh, God forbid, a re-credentialing process. No, please. I mean, I would prefer not to go there. I'm just trying to help us think about what would a larger learning community of PFs, how would that look, independent of the credentialing process? So what would that look like for the people who are in this room, and what would you like for it to look like as you go forward? So.